Let's talk first of all about the Eat Out vouchers. There's been a lot of criticism of huge sums of money possibly involved, but also the fact that the contradiction, there's an anti-obesity campaign. Everyone's got to lose weight, lose £5 in weight. But by the way, off you go. You can go and have a meal out on a Monday to Wednesday at a discount paid for by the taxpayer. Are you taking part in all of this? Will you go out to eat and take advantage of it? And will Gales artisan bakeries be included?
Yes, Gales is involved in the scheme. And I've said to my family, we're going to eat out Monday to Wednesday every week this month.
Are you serious?
Yeah, definitely.
Now, hold on a minute.
I mean, everyone's been cooking at home for the last 4 or 5 months. Aren't they bored? Don't they want to go out and enjoy a nice meal?
There is that. Now, is there not an argument, though? As a multi-millionaire, Luke, should the taxpayer be subsidising the Johnson family going out to eat?
Well, I'm a taxpayer too. And the fact is that the government are offering the money, and I think the industry needs the help, and we need to get people back into the habit of going out to eat. So if this does its bit, then all to the better.
I have to say, I'm someone going out to eat was a big habit of mine, and obviously I went out on the first day when the pubs opened and the restaurant opened, and went to local places to give them my business. But I have to say, we've been away, we've been a bit busy with other things, but I haven't really gone out much since, and I'm really aware I have got out of the habit of going out. And I think a lot of people have, and we just got used to being at home, haven't we? And this idea that we were all suddenly going to be out and about and spending our money hasn't really come to fruition.
No, and so the industry needs a boost. There are millions of people that work in it. It's an important contributor of taxes itself. And I think it is about reminding people that there's good fun to be had, that restaurants and pubs and so forth can be safe, and that on a Monday and Wednesday when they're not that busy anyhow, then why not take advantage?
Yeah, that's a crucial point, isn't it? Because the point is it's not available on a Friday or a Saturday when it would likely be busy anywhere. But on the days when restaurants, even in the best of times, would not be very busy. So people who perhaps would be more fearful of venturing out can realise how safer it is. Do you think the mask issue is putting people off? Now, you don't have to wear a mask in a restaurant or bar for obvious reasons, but they are expanding the indoor places where you do need to wear a mask. You have noticed on your social media accounts, you are very, very anti-mask. Have you been refusing to wear a mask? Do you think they're an issue for getting people out and about and back to work and back out and about?
I don't think they help, no. And I think it's very perverse the way that introducing masks happened when it did, when it's very clear that the virus appears to be in retreat more or less everywhere. So the rationale for bringing masks in now in shops and so forth, I fail to get.
And there has been some talk, some early polling that suggests that footfall in shops, in retail shops, has actually gone down just by a very small, about 1% since masks were introduced. Now, this may have actually been down to the fact that people have been away on holiday, or even if they're sort of having their old staycation, they're not doing what they normally do. But if there is any evidence that masks put people off going to the shops, should the policy be changed? Because it does seem that an awful lot of this policy is about confidence, isn't it? It's about this view, and I think it's been focus grouped by number 10s. They do everything these days, that actually, majority of people would feel more confident going out and about if other people were wearing masks rather than being put off wearing masks. But if the actual reality is different, do you think they'd change the policy?
I don't know. I have to say I see quite a lot of people not wearing masks going shopping, and clearly in places like Holland they have already said they're not going to bother introducing masks because they don't necessarily believe it makes any material difference. As you say, I think it is more symbolic. And unfortunately, I am of the view that it can be off-putting. It's a constant, relentless reminder of disease and sickness. And somehow...
Shouldn't we have that? Shouldn't we have that reminder to make us remember to sort of keep apart?
Well, all the time, every time you're out of the home.
Yes,
is it really
isn't that the whole
that
point?
bad? I think that it is all part of the failing to get the disease in proportion relative to other aspects of life, from education to work to travelling on public transport, and particularly schools, for example. If schools can't go back normally, then I think that will be devastating and a terrible mistake.
Well, indeed, I completely agree with you. I would have left the schools open throughout the time. The evidence is really very clear. But we are looking at the prospect now at teaching unions. What a surprise, raising concerns, despite the fact that every country where schools have either stayed opened or opened up months ago, there's been no recorded incident of a teacher catching the virus from their pupils. And of course, obviously, we've got a concern that viruses can spread among pupils and families could get. But maybe it's the case that those of us who've got kids at school have to sort of perhaps operate rather more social distancing than others to make sure we don't spread any disease that we get back from our kids. But the crucial thing is to get kids back to school. That's getting the economy back up and running, kids back to school. Those are the two crucial things we need to do now, perhaps rather than focus so much on not spreading the disease. But a lot of people would say, well, but it's the fear of the spread of the disease. And as you said, look, maybe people are more fearful than they need to be of this disease at this time. But it's the fear of the spread of the disease that's stopping those things happening. How do you balance that? You've been a lockdown skeptic throughout, but there's lots of evidence that the fear of the disease is what's stopping it happening. So we need to eradicate the disease to get people back to work and back to school. But we're not going to eradicate the disease in the near future. So what's the answer?
The answer is for the government to change their messaging. The government and SAGE and their advisors continue to frighten and worry the population. And I think they are, more than anyone, with their propaganda, responsible for the fact that Britain appears, according to surveys, to be more frightened than virtually anywhere else. And the scaremongering itself is very destructive because it undermines people's confidence. It means that they're unwilling perhaps to go back to work. It means that unions don't want to go back to schools to teach. It means people are afraid to take public transport. And any society that is in constant fear for a disease that will be with us for a very long time, probably, and I don't think waiting for a vaccine is a realistic alternative. So unless we want to collapse our whole way of life, we have to get used to it and carry on. And we can't just hide away and expect it to disappear. It's not going to happen.
That's the reality we've seen in Australia, isn't it? Melbourne's gone back into a 6-week lockdown. A lot of the countries that locked down very, very early on and seem to apparently be the big successes in dealing with this in the Western world, they're now facing a bigger viral spikes the moment they come out of lockdown. Do you think that we are going to just have to learn to live with this virus and live with a subsequent death toll? Bearing in mind, I think only 8 people died of coronavirus yesterday.
Yeah, and I think we have reached close to herd immunity. I think
the scientists say that we've not reached that level.
Well, maybe not. I don't know. But the truth of the matter is it does appear as if the virus is diminishing very rapidly, that the numbers of calls to 999 and the numbers of patients in ICU and obviously the deaths are diminishing. And, there are many other diseases over history that humans have adapted to without this idea that we have to go into heavy lockdown. And I think the entire policy has been a mistake. And there isn't proof to me that it's really saved lives.
Again, we've got one of the highest death tolls in Western Europe, and if you look at excess mortality, so that ignores how you're counting community deaths, hospital deaths, people with COVID, of COVID, all of the different difficulties there. It looks like we have got one of the worst death tolls. How do you account for that if we've got one of the worst death tolls and we've gone into lockdown?
I don't know. I think it could be to do with things like levels of obesity. It could be the way in which we measure coronavirus on death certificates, and perhaps other countries are doing it differently. I also think that whenever we look at this, we fail perhaps sometimes to take account of all the other collateral damage. And I don't just mean unemployment, but I mean mental illness and damage to children's education and other diseases that are not being treated or diagnosed, like cancer in hospitals. And so this obsession with just COVID to the elimination of all other aspects of life, including other illnesses, is, I think, very damaging and mistaken. And I think we have to get it back in proportion.
Yeah, I mean, I'd have to say I do agree with you on that. I think it's absolutely extraordinary that we're not, treating people with cancer in their 40s, but worrying about people in their 80s who may die of coronavirus. With all due respect, every life is worth something. But I'm sorry, I think most people would say someone in their 40s, life is more important to save. And I'm sorry, I've got parents approaching their 80s, and I'd still say that about them.